Hello, my name's Jude. I'm an occupational therapist and I'm here today to talk you through a 5-minute seating audit that you can do to reduce the risk of pressure ulcers. It's important to note that incorrect seating can significantly increase the risk of pressure ulcers. And this is just, as I say, a 5-minute check that you can do to reduce that risk. So a pressure injury can occur when there is sustained pressure that restricts the blood flow to a particular area of the tissues. Ill-fitting seating leads to an increased risk to those bony areas. So it might be your sitting bones, it might be your elbows, it might be your shoulder blades, your hips. We always want to focus on prevention over treatment. So this 5-minute audit consists of 7 checks that you can do, and you don't need any equipment to do any of the checks. So number 1 is to look and check if there is a 2 to 3 finger gap between the back of the knee and the front of the seat. So this section here, if you've got someone sitting in the chair, you want there to be a 2 to 3 finger gap here. If the seat is too deep, then the person sitting in the chair can slide forwards. They'll slump, and that creates increased friction and increased pressure on the lower spine. If the seat is too shallow, then there's just not enough support. So number 2 is the seat height. You're looking at whether the feet are flat on the floor or the footrest, because if the feet are dangling, this can cause an increase of pressure through the thighs or through the sitting bones. Because there's no weight going through the feet into the floor, the whole weight of the upper body is then put through there's increased weight of the upper body through the sitting bones. Number 3 is the seat width. If the seat is too wide, this can increase the chance of leaning, which then leads to uneven pressure distribution. Number 4 is the backrest support. You're looking at whether there is sufficient lumbar support and whether the person is slumped or sliding out of the chair. Number 5, can they rest their arms without hunching? So if the armrests are too high or if they're too low, then this creates a weight shift as well. Number 6 is the cushion condition. So if your cushion is not fit for purpose, then it's going to cause all sorts of problems. Is there an appropriate pressure relieving cushion if needed? And is it being used correctly? So is it the right way around? Check that it's not upside down. Number 7 is looking at skin and posture red flags. So that's including things like redness or marks, any asymmetry, any signs of discomfort. So if you are working with an individual or have a family member who is not able to voice if they are in pain or discomfort, then looking at their behaviour as an indicator of that. So if they're shuffling about a lot, for example. It's really important to monitor regularly and make minor adjustments as required. And of course, be sure to raise any concerns with your clinician, whether that's your OT, your GP, your district nurse. For example, any redness that you're concerned about. Vivid Care do offer a free, no obligation equipment assessment to help map your clinical recommendations with the right seating solutions.